Chairman Colby.
Here.
Mrs. Draw. Mr. Gamina is excused. Ms. Cayley. Mr. Lightfoot is excused. Mr. Marionetti. Dr. Quattro.
Is there anyone signed up for public forum?
There is not.
Is there anyone present that would like to address this committee at this time? Seeing none, we'll move to the next item, which is the food of the month. It's March, maple syrup month. Maple syrup is very sugary. Actually, the interesting about maple syrup, the sweetness level of that compared to sugar is a third sweeter than sugar. So in other words, if you were substituting maple syrup for sugar, you only have to use 3 tablespoons instead of 4. And the calories are less per unit of sweetening. So if you want to sweeten your drinks and not have as many calories, use maple syrup. Also, maple syrup has as much calcium as milk does per quart, if you want to drink a quart of maple syrup. As much potassium as banana, has vitamin B and iron and phosphorus, which you would not get in sugar. Only about 20% of the maple trees that are usable for maple syrup are tapped in New York State. New York State is #2 in maple syrup production in the state, or in the United States. Vermont. That was an easy one. How many gallons of since you guys seem so knowledgeable, how many gallons is that?
35.
I honestly don't know. Depends on how thick you want it.
That's 43. What else is there?
Has this year been an extremely easy year?
It's been a very good year because it all depends on, you need fluctuations of the temperature. The warm weather brings the sap up in the tree, and the cold weather puts it back down. And so you need to be going up and down in order for them to collect them. But the sap, really the sweetness of the sap all depends on last year's growing conditions, because it put the sugar in the ground in its roots last year. So that's all I have, unless somebody has a question about maple syrup.
How many sugar shacks were down here?
I don't know.
So a lot.
I don't know. Yep.
My question is, this has been a good year for maple syrup running?
Yeah,
Even though it's cold?
because it's cold, because we've been getting the sunny days.
It just took longer to happen.
Actually, they were running when we had that warm weather in early February. They were running then. The other thing is, if you're buying maple syrup, you have 3 grades: light, amber, and dark. The light is usually done early in the year, and then as you go on in the year, it gets darker. The only difference is later in the year, it's usually a stronger maple flavor. The darker it is, the more maple flavoring. The light syrup is usually not as maple. Same sugar content. All right, better get on to that agenda. The next item on the agenda is approval of minutes. You have the February 25th meeting minutes before you. They stand approved unless the clerk is notified of any changes by the end of the day. Next item on the agenda is new business. Madam Clerk.
Referral 14-0126.
Moved by Dr. Cabone, second by Dr. Quattro. Legislator Andrews.
Administration, with the acceptance of this funding, do we intend to grow the Nurse-Family Partnership Program at all during this year? Are we ever going to fix the microphones?
Through the chair, I guess maybe this money is really going to be used maybe to maintain maybe the same level of support, I guess maybe for the Nurse-Family Partnership Program. And it was point out that this particular grant money is for like a multi-year grant, through 2016.
I'm sorry, what was the last part?
This is a money that supports, I guess, maybe through 2016.
Thank you. Does the receipt of this funding displace then or supplant any local funds that used to go to support Nurse-Family Partnership? Through the chair.
Through the chair, no, it does not.
Thank you very much. Just Just one other quick thing through the chair. Oh, never mind. It's fine.
Anybody else have any questions? You look like you're thinking.
No, I'm going to pass.
All those in favor, say aye. Opposed? Motion carried. No more referrals. Are there any other matters to come before this committee? Legislator Kaylee.
Thank you. Through the chair to the administration, if I could. I had a follow-up question to the nurse family practitioner program, but it didn't have anything to do with that particular grant. Could I ask that now?
Is it a referral, based on a referral that we've had before us?
It's just an additional question.
Well, let's go and see where you go with it.
Thank you. It has nothing to do with maple syrup.
Well, then maybe we won't go there.
Well, I could weave
Okay.
maple syrup into it.
Let's go.
Thank you. Through you to the administration, with regards to the nurse family practitioner program, is it possible? No, I'm not wording it right. I'm sorry. That when a nurse is visiting the property where a family resides, is it ever part of their responsibility, or is it allowable for them to make a recommendation for testing within the household if they feel that there could be an issue with lead?
Awful quiet.
Through the chair, part of the role that our nurses have when they do their home visitation maybe program is to focus, primarily, I guess, during the pregnancy and the care that they're delivering in that setting for that program. And part of that delivery of the curriculum is also to make appropriate linkages maybe to other programs that may be relevant. And so whether that's maybe referral for testing, as the case may be, if there are certain maybe risk factors because of where they're at, whether that's associated with lead or other things, oftentimes our mechanism, for making those linkages is primarily going to be with the primary care provider that client may be going to already. That's not to say that there may not be opportunities maybe in the future for us to look at more comprehensive, more integrative maybe approach with regard to lead poisoning. And we certainly have that among other ideas on the table as we think about New York State's Department of Health priorities.
Thank you.
There'll be Legislator Andrews.
Thank you, Mr. Chair. Through you, I had a question today. There was a press release done today by the Coalition to Prevent Lead Poisoning that cited a slight increase in the number of children who tested positive for lead poisoning. I wondered if Dr. Kennedy would comment on that, please.
Yes, through the chair, there was a slight increase in the number of children who tested positive from last year through 2013, and yet when you do a statistical analysis, that's not statistically significant in terms of what that difference is. And then part of the idea is too is last year that was when we began using a lower standard as well. We went from maybe 10 to 8 micrograms per deciliter. And so that also might have contributed, if you will, in terms of detecting more because you are using a lower benchmark for testing. The other thing that's probably more important than any year-to-year levels is looking at the overall trend, and that actually is reflected also in the press event that we had earlier today about the Monroe County experience as we compare that against New York State and the country. And the data maybe show that our rate of decline came down, more than twofold greater than the state and nearly twofold as great as the U.S.
Thank you. Through the chair, then, do you still view this as a high priority area, or are you comfortable with where the numbers are at, or what's your?
Through the chair, yes, we certainly view this as a high priority area, and that's also consistent with New York State, maybe Department of Health in terms of being a high priority area as well for the rest of the state.
Thank you. A question on a different topic. Last week in the RBJ, there was an RFP on Friday for a quality control auditor for the Department of Human Services. Could someone, through the chair, explain what that's for, please?
I don't know if that's relative to this committee at this time. We'll see a RFP when it comes before us.
Well, it's a quality control auditor for our department.
We don't have a referral before us
Doesn't
that.
have to have a referral under other matters. Those are the rules.
It
It's related to
does have-
DHS because it's for DHS.
Yes, it is, but I don't think
I
at
just
this
like an
time it's
explanation of
before
what
that.
it is.
You can ask in writing, we'll get it to you.
Okay. I have one other follow-up question from a referral.
Okay?
Last month, a referral came before us for the use of temporary help at Monroe Community Hospital. And you
Yes.
may recall in the evening of full ledge, I asked some questions about that. I did receive a letter after that meeting, but it didn't actually address the questions I had asked. I did get a list of 5 current providers of the temporary staffing at the hospital, but I had requested for the times that each of those different providers were used. It's unclear from the letter I received if they're all
Oh, the
currently
dates
being
they were
used.
used?
Yes, the dates that they're being used. Would it be possible to receive that follow-up information, please?
I think they're taking notes.
Yeah, unfortunately, nobody from MCH is here, so I don't know what type of information that they would have available, but I'll contact them and we'll get back to you in writing.
Thank you very much.
All right?
Yep.
There being no other matters become before the March 25th meeting of the Human Service Committee stands adjourned. The next item of the Human Service Committee is scheduled for April 22nd at 6 p.m.